Ozempic. Ozempic is a once-weekly injectable medication formulated to help adults with type 2 diabetes manage their blood sugar. Although not officially a weight loss drug, research suggests that people who take Ozempic may lose modest amounts of weight. The active ingredient in Ozempic is known as semaglutide. It is FDA approved at higher doses for treating obesity and weight-related medical problems under the name Wegovy. There was a Wegovy shortage coupled with Ozempic's weight loss effects going viral on social media. It led people without type 2 diabetes flocking to use Ozempic off-label for weight loss. The Food and Drug Administration first approved the injectable medication for treating diabetes in 2017. The agency approved a drug with a higher dose of the active ingredient in Ozempic, called semaglutide. It was approved to treat obesity in 2021, under the brand name Wegovy. Elon Musk, when asked about how he looked fit, ripped and healthy, tweeted that he was taking Wegovy. In September, Variety reported that actors and producers are quietly singing the drug's praises on Signal, an encrypted messaging app. On TikTok, the hashtag Ozempic has been viewed over 273 million times. Now, the FDA has listed both Ozempic and Wegovy as two of dozens of medications in short supply. Ozempic, semaglutide, injection 0.5 mg, 1 mg, or 2 mg is an injectable prescription medicine used along with diet and exercise to improve blood sugar in adults with type 2 diabetes. It reduces the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes with known heart disease. It is not known if Ozempic is safe and effective for use in children under 18 years of age. Semaglutide is similar to a natural hormone in your body, incretin. It works by causing insulin release in response to high blood sugar, such as after a meal. It also decreases the amount of sugar your liver makes. If you use insulin, semaglutide is not a substitute for insulin treatment. Mounjaro, Wegovy and Ozempic can all lead to weight loss, but only Wegovy is currently approved by the FDA for chronic weight management. Mounjaro and Ozempic are both approved to help control blood glucose, sugar, levels in patients with type 2 diabetes. But significant amounts of weight loss have also been seen in clinical trials. How does Ozempic work? Ozempic and Wegovy are both designed to be injected once a week in the stomach, thigh or arm. Semaglutide lowers blood sugar levels and regulates insulin, which is crucial for people with type 2 diabetes. The drug also imitates a hormone called glucagon-like peptide 1 that we naturally produce in our intestines. It limits the appetite by signaling to our bodies that we feel full and prompting our stomachs to empty more slowly. Weight loss. As a result, people with obesity and accompanying health concerns have lost weight while taking it. The medication has not been significantly studied in people without diabetes or excess weight. The medication can also reduce the risk of cardiovascular disease for people with diabetes. The active compound in Ozempic, semaglutide, is a glucagon-like peptide 1, GLP-1, receptor agonist. It works by activating GLP-1 receptors throughout the body and enhancing the effects of the naturally occurring hormone GLP-1. GLP-1 serves multiple key functions in the body. It boosts the release of insulin by the pancreas in response to food intake, which helps to control blood sugar. Likewise, it reduces the release of glucagon, a hormone that increases blood glucose, thereby also helping to control blood sugar. Ozempic is a once-weekly self-administered injection of semaglutide. It comes in 0.5 mg, 1 mg or 2 mg dosages. Is Ozempic insulin? Ozempic is not insulin. It helps your pancreas produce more insulin when your blood sugar is high. Unlike insulin, Ozempic rarely causes low blood sugar. Just as some people are prescribed medications to treat high blood pressure or high cholesterol indefinitely, some patients with obesity may be prescribed medications like Wegovy for a continuous period of time. Those who discontinue taking the medication may regain weight lost while on Wegovy. These drugs were not designed for normal weight people who want to get down being super thin. Usage in type 2 diabetes mellitus, SC. Indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus, T2DM. Also indicated to reduce risk of major adverse cardiovascular events, MACE, like cardiovascular death, non-fatal myocardial infarction, non-fatal stroke in adults with T2DM and established cardiovascular disease. Oral use, indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. For weight management, indicated as an adjunct to a reduced calorie diet and increased physical activity. For chronic weight management in adults with an initial body mass index, BMI, of greater than or equal to 30 kg/m2 in case of obesity, or greater than or equal to 27 kg/m2 for overweight. In the presence of at least one weight-related comorbid condition like hypertension, type 2 diabetes mellitus, dyslipidemia. Initiate with low dose and gradually escalate to maintenance dose of 2.4 mg per week SC to minimize GI adverse reactions. If unable to tolerate a dose during escalation, consider delaying dose escalation for 4 weeks. Intolerance. If unable to tolerate maintenance dose of 2.4 mg once weekly, may temporarily decrease to 1.7 mg once weekly, for a maximum of 4 weeks. After 4 weeks, increase back to maintenance 2.4 mg once weekly. Discontinue if not tolerated after second attempt. In patients with type 2 diabetes, monitor blood glucose before initiating and during treatment. Ozempic is not a weight loss drug. In 2 different studies looking at A1C, adults lost on average Ozempic, 8 pounds, half a milligram, and 10 pounds, 1 milligram, versus placebo, 3 pounds. Ozempic, 12 pounds, 1 milligram, and 14 pounds, 2 milligrams. From an average starting weight of 202 pounds and 219 pounds, respectively. While many people in this medical study lost weight, some did gain weight. Ozempic for weight loss, how does it work? While Ozempic is not specifically labeled as a weight loss drug, studies sponsored by Novo Nordisk suggest people who take it may lose weight. In fact, the FDA approved semaglutide for weight loss in 2021 under the brand name Wegovy. However, Wegovy provides a higher dose of semaglutide than Ozempic. 2.4 mg of semaglutide in Wegovy compared with 0.5 mg, 1 mg or 2 mg of semaglutide in Ozempic. As a GLP-1 receptor agonist, semaglutide enhances the effects of the naturally occurring hormone GLP-1. In addition to its effects on blood glucose and diabetes, GLP-1 also impacts weight via 2 key mechanisms. Affects the hunger centers in the brain, specifically, in the hypothalamus, reducing hunger, appetite and cravings. Slows the rate of stomach emptying, effectively prolonging fullness and satiety after meals. The net result is decreased hunger, prolonged fullness and ultimately weight loss. In one large clinical trial sponsored by Novo Nordisk, 1,961 adults with excess weight or obesity who did not have diabetes were given 2.4 mg of semaglutide or a placebo once a week for 68 weeks, along with lifestyle intervention. Those who took semaglutide lost 14.9% of their body weight compared with 2.4% for those who took the placebo. It's important to note that the dose of semaglutide used in this study was higher than the dose provided by Ozempic. However, 2.4 mg is the dose of semaglutide in the FDA-approved weight loss drug Wegovy. Ozempic is FDA-approved for the treatment of diabetes only. It is not a weight loss medication. Its sister medication, Wegovy, is specifically approved for the treatment of weight. Even though Ozempic and Wegovy are essentially the same medication, just available in different doses. It should be noted that while Ozempic is typically covered by insurance, often, Wegovy is not. Availability. High demand and subsequent inventory and supply chain strains have severely impacted the availability of Wegovy. As a result, Wegovy has been repeatedly unavailable since its introduction and many people are turning to off-label use of Ozempic for weight loss. This in turn is interfering with the availability of Ozempic for those with diabetes. While taking semaglutide may help you lose weight while you are on the drug, most people will regain much of that weight if they discontinue using it. Studies show that stopping Ozempic completely will likely lead to regaining most of the weight lost within several months. GLP-1 medications, like Ozempic, are designed to be taken long-term. They are chronic medications for the treatment of chronic conditions, both diabetes and obesity. What are the side effects? People taking Ozempic and Wegovy for both FDA-approved and off-label use may experience nausea and dehydration. They might also feel fatigue and malaise. Their bowel movements might change, with some patients having diarrhea and others becoming severely constipated. Patients should be monitored while taking these drugs, and doctors may prescribe anti-nausea medications and laxatives or stool softeners. In rare cases, the medication could increase the risk of pancreatitis, a painful condition that inflames the pancreas. Some patients might also form gallstones. Some patients may have such severe vomiting that they stop taking the medication. Doctors typically start patients on a lower dose of medications like Ozempic and Wegovy and then gradually build up, to minimize these side effects. What are the possible side effects of Ozempic? Ozempic may cause serious side effects, including 1. Inflammation of your pancreas, pancreatitis. 2. Stop using Ozempic and call your healthcare provider right away. If you have severe pain in your stomach area, abdomen, that will not go away, with or without vomiting. You may feel the pain from your abdomen to your back. 3. Changes in vision. Tell your healthcare provider if you have changes in vision during treatment with Ozempic. 4. Low blood sugar, hypoglycemia. Your risk for getting low blood sugar may be higher if you use Ozempic with another medicine that can cause low blood sugar, such as a sulfonylurea or insulin. Signs and symptoms of low blood sugar may include dizziness or lightheadedness, blurred vision, anxiety, irritability or mood changes, sweating, slurred speech, hunger, confusion or drowsiness, shakiness, weakness, headache, fast heartbeat, and feeling jittery. 5. Kidney problems, kidney failure. In people who have kidney problems, diarrhea, nausea, and vomiting may cause a loss of fluids, dehydration, which may cause kidney problems to get worse. It is important for you to drink fluids to help reduce your chance of dehydration. 6. Serious allergic reactions. Stop using Ozempic and get medical help right away if you have any symptoms of a serious allergic reaction, including swelling of your face, lips, tongue, or throat. Problems breathing or swallowing, severe rash or itching, fainting or feeling dizzy, or very rapid heartbeat. 7. Gallbladder problems. Gallbladder problems have happened in some people who take Ozempic. Tell your healthcare provider right away if you get symptoms which may include pain in your upper stomach, abdomen, fever, yellowing of the skin or eyes, jaundice, or clay-colored stools. The most common side effects of Ozempic may include nausea, vomiting, diarrhea, stomach, abdominal pain, and constipation. What is the most important information I should know about Ozempic? Ozempic may cause serious side effects, including 8. Possible thyroid tumors, including cancer. Tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be symptoms of thyroid cancer. In studies with rodents, Ozempic and medicines that work like Ozempic cause thyroid tumors, including thyroid cancer. It is not known if Ozempic will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma, MTC, in people. Do not use Ozempic if you or any of your family have ever had MTC, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2, MEN2. Do not use Ozempic if you or any of your family have ever had MTC, or if you have MEN2. You are allergic to semaglutide or any of the ingredients in Ozempic. Before using Ozempic, tell your healthcare provider if you have any other medical conditions, including if A. You have or have had problems with your pancreas or kidneys. B. Have a history of diabetic retinopathy. C. You are pregnant or breastfeeding or plan to become pregnant or breastfeed. It is not known if Ozempic will harm your unborn baby or passes into your breast milk. You should stop using Ozempic 2 months before you plan to become pregnant. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and other medicines to treat diabetes, including insulin or sulfonylureas. Should I use Ozempic to lose weight? People with type 2 diabetes, especially those with a lot of extra weight or obesity, should consult their doctor to see if Ozempic may be a good fit for helping to control their blood sugar and lose weight. For the primary treatment of obesity, Wegovy is likewise an excellent option. For any patient who has struggled to lose weight through diet and exercise alone, has a BMI of 30 and above, or 27 and above with an obesity-related comorbidity, and is willing to use a once-weekly injection long-term. The GLP-1 medications are far more effective for the treatment of weight than prior anti-obesity medications and should be considered first-line pharmacotherapy for the treatment of obesity. However, using Ozempic for short-term, cosmetic weight loss is not recommended. While this has received significant attention in the media, Ozempic and related GLP-1 medications are not designed to be used in this way, can lead to potential adverse events, and ultimately the weight that is lost will be regained. Further, this off-label use of Ozempic is greatly impacting availability of the medication. For those who need it most, individuals with type 2 diabetes, or in the case of Wegovy, individuals with obesity. Additionally, anyone with contraindications like a history of medullary thyroid cancer, multiple endocrine neoplasia, or a history of pancreatitis should not use Ozempic. Interactions. Drug interactions may change how your medications work or increase your risk for serious side effects. Keep a list of all the products you use, including prescription or non-prescription drugs and herbal products. You should share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Beta blocker medications, such as metoprolol, propranolol, glaucoma eye drops such as timolol, may prevent the fast or pounding heartbeat you would usually feel when your blood sugar falls too low, hypoglycemia. Other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. Many drugs can affect your blood sugar, making it harder to control. Before you start, stop, or change any medication, talk with your doctor or pharmacist about how the medication may affect your blood sugar. Check your blood sugar regularly as directed and share the results with your doctor. Tell your doctor right away if you have symptoms of high or low blood sugar. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Do not use this medication with any other product that contains semaglutide. How should I use Ozempic? Ozempic comes as a solution, liquid, in a pre-filled dosing pan to inject subcutaneously, under the skin. It is usually injected once a week without regard to meals, on the same day each week at any time of day. You may change the day of the week that you use semaglutide as long as it has been 2 or more days, 48 or more hours, since you used your last dose. Your doctor will probably start you on a low dose of Ozempic and increase your dose after 4 weeks. Your doctor may increase your dose again after another 4 weeks based on your body's response to the medication. Ozempic can be injected into your upper arm, thigh, or stomach area. Rotate the injection site with each injection. You can inject Ozempic and insulin in the same body area, but you should not give the injections right next to each other. Allow the pen to warm to room temperature before injecting if the pen was stored in the refrigerator. Always look at the solution before you inject it. It should be clear, colorless, and free of particles. Do not use this medicine if it is colored, cloudy, thickened, or contains solid particles, or if the expiration date on the bottle has passed. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Use this medicine exactly as directed. Do not use more or less of it or use it more often than prescribed by your doctor. Carefully read the manufacturer's instructions for use that comes with the medication. These instructions describe how to inject a dose of Ozempic. Be sure to ask your pharmacist or doctor if you have any questions about how to inject this medication. This medicine helps to control blood sugar levels, but it is not a cure. Continue to use this medicine even if you feel well. Do not stop using this medicine without talking to your doctor. Never reuse needles and never share needles or pens. Always remove the needle right after you inject your dose. Dispose of needles in a puncture-resistant container. Ask your doctor or pharmacist how to dispose of the puncture-resistant container.